Today, the topic of discussion is related to a drug which is commonly used in the treatment of CKD, chronic kidney disease. The discussion is related to the concept behind using this drug in CKD. So, what is that drug? This is alpha ketoanalogue. What is the role of alpha ketoanalogue? Why we are using it in the treatment of chronic kidney disease? So if we take the problem of chronic kidney disease, starting from stage 3 downwards, whenever a poor patient is taking a high protein diet or even a normal protein diet, it leads to the metabolism which result in the amino acid metabolism to be particular, result in generation of the waste products which contribute to the development of the uremic toxic molecules in the form of low molecular weight, middle molecular weight, and high molecular weight toxins. In gross, we can say as uremic toxin accumulation. So this is one problem related to the chronic kidney disease. This problem can occur in acute kidney injury also because of not only diet, many other contributing factors which result in the accumulation of the uremic toxin. This is the first concept that everyone might be aware of. Not only that, CKD, chronic kidney disease, because of the multiple systemic problem in the form of endocrine dysfunction, chronic inflammation. Chronic kidney disease itself is a stage of chronic inflammatory milieu in the body. Apart from that, hyperuricemia, high FGF23, the patient appetite might not be there. Along with the comorbidities like hypertension, diabetes, uremic toxins lead to muscle catabolism. All these leads to patients' poor dietary intake, a catabolism along with poor dietary intake, along with patient's loss of appetite leads to protein energy wasting and malnutrition. Because of malnutrition, patient develops infection or the problems related to that. It is the second problem related to the chronic kidney disease. So, in summary, if we see chronic kidney disease, because of the multiple systemic impact, the patient is having protein energy wasting, which is leading to malnutrition. To avoid this malnutrition, if I advise a protein in the CKD patient, it will lead to the progression of the uremia, increasing the kidney load. Higher the amino acid metabolism, higher the toxin generation, higher will be the load on the kidney, thereby whichever the function of the kidney which is remaining, that will also progressively decline, and also the uremic toxin will also accumulate. So there are two important concepts we have seen related to the CKD. So what is this dilemma? If we give a high protein diet, there's a problem of uremic toxin. There is increased waste product worsens the chronic kidney disease. So if I reduce the protein, what will happen? The malnutrition will increase. This also worsens CKD because of the malnutrition and catabolism and other poor quality of life and the recurrent infection. This will happen. So what is the solution between these two? To bridge these two problems, there is a role of alpha ketoanalogue. So what is the concept behind this keto diet? If we take the CKD, If you give a LPDs, low protein diet leads to malnutrition through multiple systemic impacts in the form of recurrent infection, other impacts of malnutrition, vessel dysfunction, further kidney damage can occur. On the contrary, if I give high protein diet, the kidney will get damaged because of the excessive uremic acid generation and also increasing the load on the kidney. Both became a vicious cycle as shown over here. On this side, there is a malnutrition, kidney damage. If high protein diet is given, there is a kidney damage because of the problem associated with the high protein diet. So how to overcome this? Keto acid bypasses or forms a balance between these two and delay the CKD progression and improve the nutrition. How it is doing? Let us see. So this is the pathway for generation of the blood urea nitrogen. As you see here, this one is combining with this one and forming the blood urea nitrogen. Keto acids are nothing but the amino acids without the ammonia group. So what will happen? This will take the ammonia from the bun, that is the transamination, which mainly occurs in the liver, muscle and the brain, and forms to the essential amino acid. So whenever the essential amino acids are available, which patient usually gets from the diet, the malnutrition part is handled. Since this won't generate uremic toxin and also takes ammonia from the existing uremic milieu, it forms into essential amino acid. So this is the concept behind giving keto acid in CKD patient. So basically this is a structure of an amino acid. This is the structure of a alpha ketoanalogue. You can see the difference. Ammonia is there in the amino acid. Suppose if the patient take it by diet, it might lead to the uremic acid generation. Suppose if the patient takes alpha ketoanalogue, the uremic generation is less. Okay, this is the concept behind giving alpha ketoanalogue in CKD. The main advantage is this component ammonia is not there in the alpha keto acid and it takes from the blood urea nitrogen and forms into the essential amino acid, which are the building blocks of the essential amino acids in the body. So alpha ketoanalogue helps in reducing the uremic toxin generation and also essential amino acids being generated or supplied to the body, thereby the malnutrition part is taken care of. So this is the concept behind giving alpha ketoanalogue. What is the dose and all we will see in another video probably. What is the other common question that I usually encounter is, sir, whether in AKI alpha ketoanalogue is having a role or not. AKI versus CKD. Alpha ketoanalogue is more in the treatment of CKD. Why? It is balance between chronic malnutrition and the supply of essential amino acid. As the name itself says, it is AKI, so there is a high chance of recovery. So why to give alpha ketoanalogue to manage the nutrition or manage the uremic milieu? It is more in the CKD where these two problems are very common, whereas in AKI, if you treat the etiology, the kidney itself will recover and it will take care of itself. With respect to uremia, the patient can go on with the diet. So that is why the role is it in CKD, it is not in AKI. And another question do come. So if I add alpha ketoanalogue in AKI, does it have any harm? See, in AKI, the insult might be there. There's a chance of recovery. Probably it might not be required. Even if you add, it will add to the pill burden. And one more concept is this alpha ketonologue in the CKD patient have to combine with some diet modification. It will take the discussion to the higher level. Just remember, it will need some diet modification in the protein so that the most benefit from alpha ketonologue will come. Whereas in AKI patient, it will be very difficult to achieve that, and also in the short period of time, these kind of analogs might not give any benefit. If you add, is it a harm? No, you can add it, but it will add to the pill burden. Most of the time in my clinical practice, I usually give only it for CKD patient. So this is regarding the alpha ketonologue and the concept behind why it is being given in the CKD. Bye bye. We will see in the another video.